When we talk about anatomical terminology, we first need to consider the anatomical position and then the directional terms. So, first of all, you need to know that the standard anatomical position is essentially like a person standing at attention, for example, in the military. So, the body is erect, the feet are slightly apart, the palms are facing forward, with the thumbs pointing away from the body. And that's very important to remember that it's away from the body. So we're going to be learning that the thumb, for example, should be more lateral than the pinky. So the pinky would be more medial, and that will make more sense in a few slides. So then directional terms are used when we consider this standard anatomical position. And it's very important, especially in the medical community, so that we can accurately diagnose or describe the information about what's going on with the patient. The other important thing for you to remember is the right and left refer to the body being viewed, not yourself. So it's almost the opposite of yourself. Your right is their left, your left is their right. The regional terms are going to be based on two major divisions of the body. First of all, the axial division is going to be the central axis of the body, the head, neck, and trunk, and that will include things like the thoracic cage, the skull as well. Then there's everything kind of hanging off of the axial region. That would be the appendicular region, which would be the limbs, the legs, and the arms. The regional terms then are going to designate specific areas of the body within those body divisions. And we'll see some of those on the next diagram. So on this diagram, I'm going to point out some of the very important ones that you'll need to be able to label for lab, but remember there's no diagrams on the lecture exams, so you'll need to be able to define where they're at. So for example, on the test, if I say, what is the forehead? You should be able to tell me it's the frontal region. This is a great time where you can make note cards. Note cards are some of the most successful ways to be successful in this class. Some of these words then are going to be common ones that you've probably already heard. So orbital, you probably know that's the eyes. Nasal, nose. Buccal is the cheek. That's a new term. You know, oral. Mental is the chin, which is probably new. The regions are going to be these bold-faced words like cephalic, cervical, thoracic, abdominal, pelvic, upper limb, manus for hand, pubic, genital, lower limb, and pedal for foot. And these would be all the anterior or ventral views. So on the front of the body. Also on the posterior or dorsal view of the body, we have the same ones, which I'll highlight. Cephalic refers to the head, cervical, neck, back, which is the dorsal plane, upper limb, manus, lower limb, and pedal. So going through the rest of these specific terms, on the anterior side, we have the sternal, which is sounds like sternum. You've heard of that. Axillary is the armpit. Mammary would be breast. Umbilical would be where the belly button is. Inguinal is the groin area. Acromial is a new term, and that's the top of the shoulder. Brachial is the arm, where your biceps brachii is. Antecubital is the front of the elbow. And I want you in particular to notice that when we break this word up into two parts, ante means before, and cubital is referring to elbow. So in front of the cubital. The olecranon is on the back, on the posterior side, or the posterior side, and it would be the back of the elbow. Antebrachial is the forearm, and again, we see the prefix anta. and brachial. So it's before the upper arm. We have metacarpal, palmar, pollex, which is the thumb, digital, coxal is the hip, femoral sounds like femur for thigh, patellar is the kneecap, popliteal is actually posterior, and that's the back of the knee. Curl is new, that would be the tibia. Sural is the calf, which again is posterior. Fibular is the same as peroneal. Then in the foot area, the pedal area, we have some of these listed. Hallux is great toe. And then over here, we have a lot of the same ones that I've already mentioned to you, but they're all very important to know. And spelling is very important. And I want to show you an example of why. So perineal is between the anus and the external genitalia. Notice that there's an I here, and over here, peroneal is the lateral leg where the fibula would be. So we change it by one word, it's a completely different region. So you can see how spelling is very important. And spelling will be important more for lab, but for lecture, you need to be able to recognize it. It is multiple choice, but of course, you need to recognize the correct one. Otic would be the ear, occipital is the back of the head, scapular is shoulder blade, and a lot of the rest of them should be very familiar. So it's important to first learn these names. After you learn them, then you need to be able to relate them to each other with directional terms. This slide is showing the body planes and sections. And planes are super important because they're for the anatomical study. For example, when somebody gets an MRI or a CT or an X-ray, we need to know these planes. So there's three different planes. There's the sagittal plane, which is in the um, um, basically sectioning the body into right and left halves. If it's in the very middle, so there's equal right and left half, it would be mid-sagittal or median. And median is going to be different than a word called medial that we'll see on the next slide. Parasagittal would be parallel to the sagittal plane. The frontal or the coronal plane would separate the body into front and back, and I'm going to use anatomical terminology. So the anterior and the posterior section. The sagittal would be right and left sections. And then the transverse or the horizontal plane would separate the body into superior, which would be higher, and inferior sections. So the sections are specific cuts along the body plane. And again, they're named for the cut. So a sagittal plane would be along a sagittal cut. So the frontal or coronal section, the cross section, or the oblique section. The oblique section is kind of like the diagonal section. This slide is showing the different directional terms and examples of them. And there's 5 different pairs of them. So when you make note cards, it's good to put the 2 terms on one note card. So for example, on one note card, I would put superior on one side, and I'm going to use colors that are opposite. So we're going to use green and red for red light. So you'd put superior on one side of the note card, inferior on the other side of the note card. So when you say superior, you are saying that something is above something else. The example here is the head is superior to the abdomen. The opposite of that would be inferior. So the navel is inferior to the chin. And then you want to replace these words like chin with the anatomical term like mental. The next pair is anterior or ventral, and the opposite is posterior or dorsal. So we have The breastbone is anterior, it's in front of the spine. And the opposite of that would be that the heart is posterior or behind the breastbone. And again, you're going to want to replace breastbone with sternal. So work on replacing those everyday words with the anatomical term for that area. The next pair, which is opposites, would be medial and then lateral. The medial means, for example, the heart is medial to the arm. It's closer to the midline. And the opposite of that is lateral. So the arms are lateral further from the midline. And in this case, there's actually an additional one called intermediate that you can use when there's three structures that you're comparing. For example, we could say that the heart is intermediate to the lungs because it's between both of them. In this case, they say that the collarbone is intermediate between the breastbone and the shoulder. And again, you want to be able to replace these like collarbone. Instead, you would say clavicular, or shoulder, you might say acromial. The next set is proximal and distal. So for proximal and distal, first of all, are only used for the limbs. So that's really, really important for you to remember. Only used for the arms and the legs. So I want you to think of either the shoulder or the hip as the most proximal part. Therefore, the fingers and the feet would be the most distal part. So it's going to be used when we're comparing two parts on the arm or two parts on the leg. So in this case, the knee is further from the hip than the thigh. So we'd say the knee is distal to the thigh. The opposite of that here for the upper limb, the elbow is closer to the shoulder than the wrist. So we would use the word proximal. The last set of terms that we can use would be superficial or external, and the opposite of that would be deep or internal. And this is often used for layers of the skin or muscles. So since the skin is the most superficial layer, we would say it's superficial to the skeletal muscles. And if we talk about the visceral layer, like an organ, we would use the term deep. So we would say the lungs are deep to the skin. This image is showing us examples of these sections on an MRI. So if we zoom in a little better, you can see how this individual is divided into right and left sections. So that's why first of all, it's a sagittal, and because it's exactly in the middle, it's a mid-sagittal plane. In this example, this individual is separated into an anterior section and a posterior section. So it's a frontal or a coronal plane. In this example, she is separated into a superior half and an inferior half. So that's why it's the transverse or a horizontal plane.